Let's bring him in, our good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe. What do you have on your list today?
Hey, Ray, gosh, that Amish trip sounds so good. I want to be a part of that, man. That's the stage I'm getting to, and I love Amish country, so save me a seat.
I'd love to have you on board.
Thanks. Hey, I've been really mean in the last few weeks, and I've been remiss in talking about this topic I'm going to talk about today. It's so important and been so missed. We had a great talk on it at our conference at Children's Sports Medicine Conference a month ago, and I never got to it with all the other things going on in sports. It's called concussion rehab. It's so important after concussions, and sometimes I actually feel that it could be as important as like somebody who sprains an ankle and the rehab they do, but people don't understand it. They don't utilize it well, and people end up with chronic symptoms from concussion. And so I want to go over a couple points, 5 or 6 points with concussion rehab. Number one, we talk about that we've really done a pretty good job improving things with concussion from the near crisis we were at a decade or two, 20 years ago, 15 years ago. Things are definitely improving, and we talk about things like, oh, my gosh, rules changes and protocols and early recognition and all this stuff. But I think a tool that people don't realize how important it is concussion rehab. And so talking about exactly what that is, with sports-related concussion, most symptoms resolve pretty quickly in the first 2 weeks. We know that, 80% or so. Some people continue to have significant symptoms, and they definitely need rehab. Some people have subtle symptoms. They keep having headache, neck pain, problems with concentration when they're trying to play sports or balance, or they just can't even explain. They just don't feel right when they're playing sports. And those are people that would really benefit from concussion rehab. The other thing is we always knew there was 2 to 3 time increased risk of having another concussion when you've had one. I really now believe after 40 years of dealing with this problem that a lot of those recurrent concussions were because people never really rehabilitated these symptoms around the neck and the brain and the nerve areas, the eyes and things. And now we have really great tools to rehab these things. And I think we could do better than the fact that so many people get recurrent concussion. But the studies that really were staggering to me, the studies that have come out in the last 10 years that say 30 to 40% of kids that had concussions within 3 or 4 months get other musculoskeletal injuries. We, again, didn't really realize. I'd kind of look in and see, oh, my gosh, now that kid has a shoulder injury or a neck or a knee injury or an ankle injury. There's other injuries that occur because they never fully rehabilitated their concussion. So concussion rehab, they start with with some manual therapy, hands-on therapy in the neck, in what's called the oculomotor system. Sorry to use big words. Coordination and balance. There's lots of exercises for coordination and balance that's critical for athletes. And their eyes, visual symptoms and visual exercises they do to try to get the brain back working again when you're playing sports. And so the problem is only about 10% of athletes have access to or utilize concussion rehab. So I'm here to really let people know our region is so good in sports medicine. Throughout Northeast Ohio, there's plenty of really good places for concussion rehab. And people ought to look for it when they're not feeling right after a concussion, or they have a concussion with lingering symptoms, or they get other problems after having the concussion. The people that really could be helping us, and that I'm addressing this to too, are the trainers are really good. The athletic trainers will tell kids, get in for concussion rehab. You'll be surprised how good it is. Coaches, parents, I want everybody to be aware of what a great tool this is. And I think it's really been what's helped us a lot in improving in concussion. The other thing, they give a lot of exercises, and just like you should be doing exercises for your shoulder injury or you were talking about your Achilles a few weeks ago, you should be doing exercises on their own. So these athletes learn exercises from these specialized physical therapists that they can do every day on their own to keep getting better. If they don't do them just one time, these are exercises and they take ownership of the problem. Many of them have psychological issues and anxiety because they're just not feeling quite right. So only about 10%, 15% of PT places have an experienced person that does concussion rehab. So make sure when you go to a place, it's a place that's done a lot of concussion rehab because you learn from experience. Of course, at a Children's Sports Medicine Center, we have several. We have one of the best around in the state, Dan Norman, who I talked to before this talk to get a couple of key points. Dan's great. He's been doing this for over a decade. And the experience really, really helps. Taking ownership of this really, really helps. And I think we could cut down on those number of recurrent concussions. We could cut down on the number of those other injuries that really surprised me through research in the last decade. And I think we could cut down on these athletes that just don't feel right after they've gone through a significant concussion. So I was remiss in not letting people know. Really look up and be aware of this thing called concussion rehab, which I think has really helped us improve the way we deal with concussion in the last decade.
All right, Joe. Great information. And I know you've been on top of this for more than a decade, my friend. You and I have talked about technology, advancement, research for concussions. Gosh, it's probably been close to 20 years that you and I have been talking about this.
Yeah, do you know, though, I mean, for a while there, sometimes we go through concussion seasons, and this isn't just a football thing by any means. Oh, my gosh, this time of year, if you came through our concussion clinic, you'd see the lacrosse kids, and you'd see the soccer kids, and you'll see the basketball left over from basketball season, not just the football thing at all. Yeah, we have been talking about this, but sometimes we were talking about it more than others, and there was a lot of concern it was really going to threaten the benefit of all of sport. But we're doing better, and one of the reasons is this kind of hidden or misunderstood area called concussion rehab. So thanks so much for letting me talk about that today, Ray.
You got it, my friend. As always, thanks for the insight into sports medicine, and I know a lot of people who listen to the show give me good feedback how they enjoy your segment with us on Wednesday morning. So, Joe, thank you, my friend. Appreciate it. We'll do it next week.
Have a great week, Ray.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, on board with us.